you're seeing in your work and in your practice as a pediatrician, and what your thoughts are about the risks for children at this time, and any thoughts you might have about mitigating those risks.
Okay, so thank you so much for inviting me to be part of this conversation. And for those of you who are dialed in and participating in this discussion with us, thank you for your interest and attention to this. I think this is a really different experience for all of us in all of our different professional capacities, and we are in new territory. And I want to say that there's a lot that we still don't know about what's going on now and what will be going on in the months to come. So there is a lot that's really unknown. We who do child abuse work primarily know from our literature and our past experience that in the Great Recession, we saw a significant uptick in abusive head trauma. That was not just local, but that was a national phenomenon that was seen around the country. And that we know in general that times of economic stress bring increases in child maltreatment. So of course, we're really concerned about that given how much economic stress is going on in the pandemic and how much is still to come. We think that is going to hugely increase risk for children. And of course, it's not just economic stress that people are facing. There are a whole host of stressors that people are facing in the pandemic, and that can increase risk for child abuse. For physical abuse, babies and toddlers are at the highest risk. They're at the highest risk to be physically abused, and they're at the highest risk to die from physical abuse. So we spend a lot of time focusing in the child abuse world on helping people to understand that babies and toddlers are at the highest risk of physical abuse and of fatal injury. And unfortunately, they can be the least visible. At times they can't interact with you, they can't talk. You might not be seeing them as much as you might see older kids. And I think that's also true in the pandemic. So if you're working with families where there are babies and toddlers, paying attention to the well-being of those babies and toddlers is pretty important. We're also concerned about the possibility for more sexual abuse in the pandemic, with kids being at home more, less ability to talk to people outside their homes. Most sex abuse comes to attention because kids disclose about it to someone else. And also recognizing there's a lot of time online. Kids, everyone, all of us, and especially kids, are spending a lot more time online than they used to. And there are a lot of ways that kids can be sexually abused online. And so we have concerns about that as well. But really, it is too soon to say how the pandemic is really affecting rates of child abuse and neglect. You're right that the reports to DCF are way down. Of course, that doesn't mean much, right? Schools are out. Schools are the #1 reporters to DCF, and kids are not going to a lot of other community settings where reports might be made. So it's just hard to say what's happening, really, what the rates are. And the dynamics, of course, are different now than they were in the Great Recession, where families are sheltering at home together. I think some of us in our more hopeful moments think that having more family members in the household could be protective for certain kinds of maltreatment, but I really think that it's too soon to tell. There definitely are lots of new risk factors. And I do know from DCF information too that there has been an uptick in people surrendering infants under the safe haven law over the last couple of months compared to previous timeframes, which I think also reflects the increased stresses that families are under. So in terms of recognizing, how can you pick these kids out of the crowd? How can you recognize them? This is particularly challenging when you're not having direct interaction with the families. It's definitely challenging for us in the medical setting, where there's a lot of telehealth visits going on and not as much direct physical examination of kids, or ability to directly talk to kids. And I'm sure all of you are finding that in your own professional spheres, that you have this more remote contact with families. I would say that I would want to point out to you that injuries in infants are an emergency, injuries of any kind, because babies, the normal number of bruises on a baby is 0. A baby who does not pull to stand and walk should have no injury. So if you become aware that there's an infant in a household who's injured, even if it's a minor injury, scrape, bruise, that child should go to a pediatric emergency department and get evaluated. So I just want to alert people to that idea that injured infants are an emergency. And then when it comes to older kids, we think about where on their body their injuries are. there are some body areas that we are very worried about if they're injured, and that includes the torso, which is the abdomen, the back, the genitals, the butt, this whole center part of your body. If kids have injuries on that part of their body, or their ears, or their neck, those are extraordinarily uncommon areas for accidental injury, and again, should make you worry about abuse. Those kids should get some medical evaluation in a pediatric emergency department. If you have the ability to talk directly to kids, talk to them. Ask them how things are going. Ask them what's happening in their house. You have to be aware if you're on a remote video link that someone could be just off camera or listening outside the door. You don't have as good a sense of privacy for kids, so you need to not create a risk or a problem for that child, but you can ask kids directly what's going on. And if they tell you something concerning, you can say, tell me more about that. Just listen to what kids have to say, because kids often will tell you what's going on. And obviously, if a child reports maltreatment, then you should make a mandated report to DCF. In terms of how to engage with families or mitigate risks, I do have a few thoughts about that. I think it is important to engage as much as possible, even if the only way you can do that is through telehealth or remote contact with families. Be aware of the limitations, but talk to people as much as you can. And one of the things I would tell people to do is to engage with parents about their child's behavior. Ask if their child is doing any behaviors that are a problem for them. Ask them if their kid has a behavior problem, and then try to engage around that. What's the problem? And many things that people identify as problems, in my experience as a pediatrician, are just normal child development. And one of the things that we can do as professionals is to reframe that for them and explain to them that that's actually normal behavior for a 2-year-old or a 3-year-old or a 4-year-old. That in itself is very powerful, is just reframing normal child behavior in the context of normal development. And then connecting people to concrete help. Connecting them to supports that they need, whether it's natural supports in their community or concrete supports around food, housing, and other things that they need. I think meeting people where they are and addressing the needs that they're putting forward as primary is very important as an engagement strategy. There is a resource here at Connecticut Children's that I just like to point out to people. There's a website, and I think, Stacy, you have this, so you can provide a link. Connecticut Children's has sort of a page on its website that's called a school closure kit. And it's not really just about school closure. There's lots of information there about dealing with homeschooling, but also there's stuff about creating structure for kids during the pandemic, keeping kids safe, keeping them engaged, and increasing resilience. And I think some of those are excellent resources. And for babies, the OEC has a really nice handout about keeping babies safe in the pandemic. And I think you have that as well, Stacy, and maybe you can provide that to participants so people can look at that. I think that it is helpful to have some resources to offer to the families with whom you're working. And those are two that I would point out that are very good and that are Connecticut specific. So I think I'll pause there. I guess we'll take questions and have discussion later.
Thank you so much, Dr. Livingston. And we will post all of these resources that are mentioned today with the recording of the webinar on our website, as Jay mentioned earlier. I will also try to get some of them into the chat box if I can multitask well enough. I think also Sarah Egan is planning on showing some of the resources as well when she talks. But I did want to just ask Sarah if you had anything you wanted to add about folks that your children and youth that you might be particularly concerned about during this pandemic in the work that you're seeing.
Well, I'll just speak really briefly right now. Obviously, we echo Dr. Livingston's concerns about infants and toddlers, because they're always, even without the pandemic, the children who are most vulnerable, the least visible, and the least able to tell people what happens to them. But I think it's also important to think about who are the other categories of children who, like infants, have less capacity, less ability to tell what happens to them, less abilities to report, and are less visible right now about what they might need. And those are children with disabilities. And we know that statistically, children with disabilities are at substantially greater risk of maltreatment than other children. Children with behavioral health disabilities are at some of the highest risk of maltreatment. And children with intellectual disabilities are at substantially greater risk of sexual abuse. And that is something I want to talk about a little bit more during my presentation. I would say that I think we all have a disquiet and a concern, both in Connecticut and nationally, about what are all the things we don't know that are going on for children and their families during this unprecedented time and this tremendous strain. I think it's important to inject a note of caution that, when things begin to reopen, we want to be careful not to presume that as Dr. Livingston was saying, we don't know everything that's been going on during the pandemic. I think we want to be careful not to be overly alarmist about an epidemic of child abuse that we don't know about. However, that being said, I think what we do know from prior times is that, as Dr. Livingston was sharing, families who are under tremendous strain around housing, food insecurity, diaper insecurity, lack of social support, have much greater needs. And children, may be more at risk for having their needs not met, right? And so it is very important to think about who are the children the most vulnerable to harm, as Dr. Livingston pointed out, and how we can screen and support. I think we get the most bang for our buck additionally with widespread prevention and family strengthening supports. And I know that other folks here will talk about that. How do we ease some of those stressors, in our communities by helping families with housing support, food support, interventions for their children. So.
Thank you, Sarah. And that's a very, very perfect segue, because I'd like to turn to Regina now, because I know that your program works specifically with children and families who have experienced abuse. And I know that you also do quite a lot around prevention and outreach. And you've had to adjust, as many of the folks on this webinar have also had to, in order to be able to serve families and be available to families and be a resource. So can you talk a little bit about those adjustments and how they've helped the families that you've worked with?
Certainly, certainly. First, I want to thank you for inviting me to be on this panel, which I'm honored. And COVID-19 just slamming into us really forced the Greater Hartford Family Advocacy Center to move ahead with some plans that were already in the works, but it made us go much faster. One objective has been to create new paths to services and support, to create additional ones. I think that most families come into services as a result of an investigative report. Someone has a suspicion that something has gone wrong. But we know, because of underreporting in good times when there is no pandemic, that we're probably seeing about 10% of what's actually going on. We know that, for instance, child sexual abuse is like 90% underreported. So we're looking to do that, but this made us move a little quicker. So one of the things that we did is that at St. Francis, one of the programs is the Joan C. Dahlber Food Bank. And it's not only, it's known as a food bank or a food pantry, but it also distributes diapers and personal hygiene items. And we placed a family advocate just somewhere between I guess in terms of what you say a family advocate is, really somewhere between a case manager and counselor of sorts. Putting all of that together, education and support. Place a family advocate at the food bank during all of its hours of operation to really start doing screening around social indicators of health. But that screening also includes screening for being a victim of crime, a victim of some type of violence. People often don't realize, we've learned, that what's been done to them qualifies as a crime or is against the law or is something that can be reported. And so having someone there when people are coming to get basic things like food and diapers to just kind of say, these are things we offer if someone has hurt you, if this, that, and the other. We found that certainly on the first offer, people are not jumping forward to say, I need your help. I think what has been most effective is that person is there all the time. And when a family is in need of something as basic as food and diapers, they are there on a regular basis. And the engagement takes time. That as they get to feel comfortable with the family advocate, then they're saying things like, well, I am kind of concerned about. The other thing that's interesting about that with school being closed is that people come to the food and diaper bank with their children, and you get to see them interacting with their children. And so there's a good opportunity there to start to engage. And I really like what Dr. Livingston said, and I think I'll be back in touch with her to add some of this in terms of helping to validate for parents that their children's behavior is developmentally normal. Because people are often you've got children standing in a long line waiting to get food, diapers, children's diapers, and a lot of times adult diapers as well, which for many people is a source of embarrassment. And in the meantime, the children are just jumping around doing what children do. And, parents are getting kind of tired, and it's a good place to be able to offer some support and do some education. The other thing that we're able to do is in working with community-based organizations, and I think this is huge because these children are indeed becoming invisible to us, to systems, to institutions, to professionals, if you will. They're becoming invisible as they're not being referred to us by investigators, but someone is seeing them. And so I think it's important to work as closely as we can with those community-based organizations, institutions, community leaders, people who are seeing them, faith leaders, whoever it is that's seeing them. We want to let them know that you can make referrals to us, or probably even more effectively will come to you. And so one example that I think has been a great project, for which I have to give credit to Hartford Communities That Care, working in tandem with 4 other community-based agencies, such as the Gray YMCA in North Hartford, the Blue Hill Civic Association, other civic and faith-based organizations. They made a commitment several weeks ago to distribute 1,000 bags of groceries to homes in North Hartford. And the food bank participated by donating some food, but also in that was COVID-19 information about child abuse, family violence services. And as those bags are distributed, each family receives a follow-up call. I thought the planning of this was ingenious, like I said, for which I can take no credit. But they were distributed to families for which the referring community-based organization already had a contact. They may not have a deep relationship, but they know who lives there because they've served them at some time, and they have a phone number or an email. And between all of us, we divided it up to do follow-up calls, which in a sense are like well-being calls, And then also letting people know what other basic needs we have that are available to them. Some of those things include gift cards to a department store for things that people need right now, but don't have other ways to be able to get a hold of. And so I think the final thing I'll talk about is a project that we call Project Hope. And I'll start by saying Project Hope is VOCA funded and funded by private family foundation. And I think that balance in looking at where you fund things is very important, because the government will let you pay for certain things and other things they won't, but family foundations will. So one of the ways that we get to supply some basic needs that may not be allowable by government is to make sure you balance it with donations and working with family foundations. We talk about children that are at high risk, such as children with disabilities. There are populations, general populations, that are at increased risk of violence, family violence, community violence, but they are also communities that especially avoid investigators and therefore are less likely to be responded to as victims. And the children within those families are at increased risk. So Project Hope utilizes what we call community advocates. That is a person from the target population that serves as a bridge going out into those communities and helping to bring people in for services. For our 2-year pilot, which the first year is coming to the end, the pilot are Muslim women, immigrants and refugees, transgender women of color. I need to remind people that transgender women of color do parent children, and that they're often like not thought of in that way. And we are also looking at Jamaican and other Caribbean, West Indian women who will tell you that almost the adage, informa fided, don't tell it will kill you, serves as a big, it's a big problem. And then of course, people with disabilities is one of our target groups as well. Parents with disabilities have issues that they face, and then those parents with or without disabilities who have children with disabilities face a lot of stressors. And we found, once again, I guess anything new takes a while to get rolling, but absolutely, we've seen a huge increase in people being willing to contact us, having really had someone in the community to kind of hold their hand to say, no, we don't report to ICE. We're not going to ask about your immigration status. And if you're an adult, you don't have to make a police report. And you can come in thinking you don't want to do it and change your mind and, then talk about the services that are offered. So I think the bottom line that I want to make is we are really, it sounds like one of the COVID commercials, but we really are all in this together, and that it takes all of our disciplines, and that we need to consider community-based organizations that may not be as well known to the larger institutions, but they're well known in their communities. So I think that's very, very good when we can do that. Thank you.
Thank you, Regina. I really appreciate how you've pointed out not only those partnerships you just mentioned, but really thinking critically about which populations may have all kinds of reasons that they wouldn't reach out for help, and finding a way to make that bridge. and how important that is for programs, no matter where they're serving folks. I'd like to ask Aldwin from the Village for Families and Children to also talk to us about how they've adjusted their work, not only to reach out to families and parents, but to support students who we all know have lost tremendous amount of supports with the closure of schools and the limited access they will have over summer schools as well. Aldwin, what can you tell us about your work and the adjustments you've had to make that would be helpful to folks who are watching us today?
Thank you. There has been such a remarkable shift in the way we do business. I mean, the one piece that we have to embrace as an agency first is that we have all, for the first time, experienced a collective trauma. We have all suffered tremendous loss of our way of life, of our companionships, of our peer groups, of our communication, of our freedom to move about and to go out and get the things that your family needs and bring that back home. I mean, for the first time, we went to the stores and we're not able to come back with the items we desired that were on our list. That's traumatic. And for the first time, we all experienced that together. And with that, we all then were told to stay far away from one another. So our typical means of comfort, our typical means of support, they were decimated seemingly overnight because it just slowly creeped and then it was here and undeniably here. So with that, we realized that, you know, the thing we needed to do first was to begin to connect with families and help them to understand where we are as a society. So at that point, we began to really dive in and make contact with families. And it was really about wellness checks. It was to find out how they were doing. And let me just go back. What happened first was we were calling in to check in and to find out whether or not they were connected with technology and what they were doing to begin to connect with schools. And we found out very quickly, as the feedback from our team on the ground would provide us, that they're not answering phone calls, families are not answering phone calls, families are stressed, they're just saying things we're not prepared to discuss. And we realized that we had to stop and recognize the rooting and the reality of this trauma and then realign. So then we shifted and we said, you know, what we will do at this juncture is we will absolutely spend our time treating this as a trauma intervention. So it first starts with, how are you doing? And then you begin to start working your way in there. While we have our responsibilities as funded entities, as business entities, and our sort of piece of work we need to complete, first and foremost, we have to make sure our families are well. And engaging in that conversation, we realized that the time that we would allocate towards these phone conversations, they were much more than we anticipated. And the sorts of realities and the sort of secondary traumas our staff would experience as they're listening to families and what they're experiencing, the frustration, we realized that we have to change the way we work and how we support families and how we check in. We then had to change how we support our staff after and before these check-ins, because it is a burden. That vicarious trauma is real. And from there, we then realized that we needed to begin to build repositories of information. And we mobilized our teams to begin to gather, you know, what are the spaces that can offer assistance for family, whether it be rental assistance, whether it be food, whether it be gathering information from the school district for those who students are at these pieces. How do they begin to get the support? Because again, as these things are starting to weave together, you find out very quickly that there are significant portions of the population that were left in varying, you know, stages of connectivity. So with that, we had to change our work in that our work now became more detailed. It became, we had our meeting schedule sort of, it created a more dense meeting schedule for the week so that we can take this feedback that was happening really on the ground with our frontline workers, the positive youth development workers, and they were feeding up, and management would process what these things were to find a way to be responsive. Because if we were able to meet the family where they are and meet their needs, then we can begin to truly help the family. Because yes, your supervisor informed you that this is what you needed to call and find out about. However, that family had a much larger need, looking at sort of the hierarchy of needs, and we have to stop and make sure that we care. Because the entire premise of our engagement, whether it be from this, because of the pandemic, or from when we started, it is because we care about families. And we have to make sure that we convey that to families and we're able to actively engage with them. So then we needed to begin to start tracking. And that became the sort of interesting piece, because we had processes in place where our policy is basically this: we never contact family first with bad news, right? Our concept of engagement is that from the minute you enroll in our program, we're doing weekly check-ins. We're talking to you about your child, we're finding out how you're doing, and those sort of active pieces. But now, because of the pandemic and the amount of phone calls a family may be getting, they will not respond at times. And we then have to make sure that those families that aren't as responsive didn't get lost. So these tracking sheets that we paid attention to before, but they kind of had a natural flow, really became more deliberate and more intentional, because we found that families weren't picking up the phone, not because they had better to do, but they themselves were overwhelmed, because there's a line of us that care in one way or another, and we're all picking up the phone in our mad dash to help everyone, and we were creating a bottleneck that overwhelmed families who were already overwhelmed, because they are now teachers, right? They are now nurse practitioners, right? They are now this singular entity that's providing support in ways that they would not even imagine. And learning is a very vulnerable process. Learning is the only process that you walk in the door saying, I do not understand. I am empty with regard to this particular arena. And it's a vulnerable piece. And as a parent begins to engage with being that teacher in the classroom, it also triggers their experiences with their own educational process. And that then becomes an issue for the parent. So you may be re-traumatizing that parent. And if that parent is struggling to take care of their child, which is what we all want and is what we all ask for, we then have to be able to actively engage with that parent and provide not only resources, because the goal is to get them connected with their teachers and get them connected with their schools, but we need to be able to somewhat triage and engage with them and find out sort of what they need to understand and what supports they need to be able to actively be able to voice some of the things that they're experiencing, to then begin to leverage resources. Because within this process, one of the interesting pieces is that with the disconnect that happened, it actually pushed parents closer to institutions, the institution of learning, for instance, because at this juncture, with the parent being the teacher, places where their child are, where the children may be stuck, because there is new materials being issued during the COVID time, that new instruction has to be supported directly with the parent, not just completion of homework, but new instruction. And these pieces then put that parent in a position where they're now closer to the institution where they may not have had that. So we have to support through that as well. And that was a shift in the way that we were able to do business. We then had to really make sure that our staff were not only better versed in trauma, because that has always been a tenet of our work, but because of the shift, it sort of accelerated that process. But then we had to make sure that we were able to create this quasi case management frame where they can understand what a strength-based interaction is. Most of our interactions and interactions that families have with institutions is in a deficit frame. I do not have, and I need you to save me. That framing doesn't work. It may be great as an initiator, but if that paradigm isn't shifted immediately, where it's a power with versus a power over paradigm, it will quickly fall on its face. So we have to, although the parent was engaged, and we then have to be able to shift gears so they can understand what engagement looks like, how to establish this power with, and how ultimately our goal is to act as a connective, be a connective role. In that we don't want the parent to feel that they need to come to the village to be able to talk about their child's education. It is the institution. We help you advocate. We help support you, but ultimately, the relationship that you have is with the institute of learning in this regard, and with whatever sort of dynamic you're experiencing. Our job is to help facilitate that process. So that required us to look at how our teams do work, and how we provide supervision around it, and how we retool staff to be able to actively and meaningfully engage with families during this critical time. So this thing has shifted us in enormous ways. As an agency ourselves, as we were hearing the sort of groundswell of supports that were needed, and we were anticipating some of these things, we went out and we were able to secure some funding, and we were able to sort of redirect some of our existing pieces, um, to then provide a pool of funds to support families that had immediate need. Because as we were linking them with resources, we realized that some of these resources were drying up quickly, which adds another layer of frustration to families. And again, when that corridor of hope is opened and that light is at the end of the tunnel, there in the time that the family takes to get there, that light may be quenched. So
Mm.
immediate needs, we're finding ourselves being able to actively engage early and provide sort of basic human needs supports for the families, as we were again beginning to help them connect, with the goal that with sort of these small victories, rental assistance, being able to purchase food for your house if you were unemployed due to COVID. We were then able to, through these small victories, again, case management strategy, help them to take these strengths, these accomplishments, and help them build towards these sorts of larger pieces. And the last thing I'll talk about in terms of the sort of shifts we made is that for our summer program, we typically run a 4-week summer program for all our school-based sites, um, which basically provides a sort of supplemental activity to the early start process that our Harvard Public Schools institutes. And what we did this year was, just due to the level of disconnect that occurred, um, we realized that we needed to provide services for students for the entire summer. So we actually have created a 8-week program that actually kicked off yesterday at our 7 sites, and we actually have it open to anyone. So we've spoken to our funders, and we are very thankful for the funders who have said, we'll figure out the registration process. There's the core demographic pieces, but some of the dosages that we have required, we're going to loosen that, because it's we don't quite know how to work within this area. And we do know that you're going to service a different population than typical, because now schools without walls become very critical. Because if in fact your school does not offer something, you need a place to go. We are telling families they're not supposed to be in the streets, they're not supposed to be sort of congregating in these pieces. And some families, even though we are to some degree open, they do not feel safe that way. So we have had families from other schools reach out and begin to register for our program. And again, creates a whole level of sort of workflow and logistics, but we're working through it, because ultimately our goal is to make sure that families are emotionally safe, physically safe, and where possible, financially stable within this pandemic. So those are just a few shifts that we've had to do to begin to sort of address some of the issues. And one shift kind of prior to us going back to this summer learning, this distance learning, where we're doing all technology based. I mean, it's all distance learning, it's all laptops, it's all Zoom classrooms, it's all Google Classroom. We actually are using Instagram as a tool to work with the adolescent population, because it's an app, it's very different. They get kind of a different flow, and it's something they're accustomed to. But we actually supported the school with distributions of meals. We just supported other community organizations with distributions of meals. We worked with the tech and did actually no-touch deliveries, so that families who are not digitally connected could be, because at this juncture, we're not certain of the timeline. And as long as we're able to have a space where families are able to connect with us, there is hope, there is opportunity, there is a space in which we can say we are in this together and we can get through. So those are just a few of the shifts that we have made.
Thank you, Aldwin. That's really great. And it's a whole host of interventions that you talked about there. I also know that the village has created a blueprint for districts, and we will put that blueprint on our website with the recording for today. But I do want to shift to make sure that we get a chance to hear from Sarah. And you spoke earlier, Sarah, about your concerns about children and youth who may not be able to speak up for themselves for various reasons. And I know you've been doing work with other agencies around prevention, and you have some resources that you'd like to share with this group. So I'm going to turn it right over to you to go ahead and let us know about some of that work that you're doing.
Great, thank you so much. It was really a pleasure to listen to everybody talking about all these different important themes. I know we're wrapping up our hour soon, so I'm just going to fly through a couple of quick things that folks may be interested in. As I talked about before, I think it's very important to understand that kids with disabilities are at risk. I think that intuitively that isn't something that people always know. And again, I wanted to cite a statistic for you that according to crime statistics, children with intellectual disability, or people with intellectual disabilities, I should say, are 7 times more likely to be the victim of a sexual crime or a sexual abuse crime than people without intellectual disabilities. That's not something a lot of people know, and I think wanted to put that on your radar screen. Sticking with the theme of sexual abuse, that is an issue that's received some national reporting that I wanted to share with you. During the pandemic, the Washington Post and NPR have reported that there's been an increase in calls and reports to certain hotlines regarding sexual abuse. And in one of the national hotlines, there was a 22% increase in monthly calls about sexual abuse from minors, from people younger than 18. More than half of all incoming contacts with this national sexual abuse hotline were from minors. That's a first in the history of that organization. That was reported by the Washington Post. The NPR also reported that of the calls that are coming into national sexual abuse hotlines, 67% of young people identified their perpetrator as a family member, and 79% said they were currently living with that perpetrator. I think I raised that because one of the most important things I think we want to think about is how are we engaging, not just with families, which is terrific, but how are we engaging with youth? How are we giving youth a safe place to say that they have a concern? One resource I wanted to share with folks that you may not know about, perhaps you can share on your networks, is the Connecticut Alliance to End Sexual Violence statewide hotlines, which I'll actually put the hotlines into the chat, and they have one for English. Well, I'll figure out how to do that in a second, or I'll share it with Stacy. And they have hotlines for English and Spanish, and that's a Connecticut resource that you can share with folks. As Stacy, I'm just going to pivot to a couple other topics real quick. As Stacy shared, we are part of, along with Regina Dighton and along with Nina Livingston, part of a coalition of professionals and advocates working on child maltreatment prevention. One of the populations we talk about a lot are babies, right? And one resource I wanted to share with you, let me just click my screen share, get back and click that, and Stacy can make this available to you, is, okay, can everyone see my screen? Stace, can you see my screen? Yes. Oh, that's not what I was trying to pull up.
Yes.
That was not what I was trying to pull up. Where'd my thing go? Hold on. It won't let me get, here we go. Hold on one second. Sorry, it's not letting me get to the document that I wanted to get to. Hold on. Although this is a document I also wanted to share, I can share with Stacy and share with you. This is a list of common advocacy resources that we send out to intakes. I updated it for today to include, this actually does have a few things I want to share, to include the website information for sites, including the Center for Children's Advocacy, the Village for Children and Families, Clifford Beers, and others that have specific COVID-19 research pages, and DCF that are updated regularly and speak to a lot of the family needs that we've talked about. One of the documents that my office helped to publish along with the Office of Early Childhood is this one, which is keeping your new baby safe in the time of COVID. And I want to make sure that everybody gets this document, right? This is about prevention. So this was developed specifically for this time period. And it talks about, it's a 5-page document. It talks about what are common questions I may have about my baby. Never put a mask on a baby. People may instinctively think that that's a safe thing to do, but it's actually an unsafe thing to do, right? People may not know that. So please think about, consider sharing this widely. Tips for new parents about crying and what's normal about babies, reminders about how babies sleep. You know, the #1 cause of preventable death of a healthy infant in the state of Connecticut is a baby sleeping in an what we call an unsafe sleep environment, right? This is how babies should be sleeping every time. You know, people home all the time having new babies, increased worry, concern for your baby, may think the safest place for a baby is in the bed with me, but really the safest place for baby is near the parent in their own sleep space, on their back, nothing else in there. Here's several other basic needs supports we wanted folks to have: diaper support, nutrition support, crisis support, how to connect with others. Lots of concern here about an increase in postpartum depression, right? That's a national story that's being talked about. And we really want to get away from the term social distancing and really think about physical distancing, because we don't want folks to be socially distant. We don't want them to be spiritually distant. We don't want them to be disconnected. So it's all about finding emotional support. This document also has other places to do that. So I'm going to share these documents with Stacy, our resource list, this list, and then we just stop share for a minute so that you have that. And then the last thing I wanted to share with you is about internet safety. And folks raise that. It goes along with our concerns about older kids, about sexual abuse. You know, this is a real concern, and we need to make sure that that parents and educators and others have access to trainings about how to keep your kids safe online. You can actually, I can share things with Stacy as well, but you can actually Google that and come up with sites on the United Way, and DCF has resources about internet safety for trainings for parents and for kids. So I think that's it for me. I know we're just about out of time, so I'll be happy to share whatever resources we can with all of you. But I think last I'd say, you know, our basic needs issues are top on list. You know, the governor announced yesterday an extension of the moratorium on evictions until August 25th, with an associated $33 million for a variety of housing support and rental support services. I'm sure that CCA will share with you how folks can access those dollars. And daycare, I think we all need to raise our voices. We're all advocates on this call, and we need to raise our voices and advocate for as much funding as we can possibly get for a daycare industry that I will tell you is disintegrating on our watch, not just here, but across Connecticut. For about 40% of daycare operators have already announced they've had to close their doors, and the state is trying to keep folks afloat through the summer, but we'll need a lot more, hopefully from the federal government, to support that critical childcare industry necessary for child population health, well-being, and safety. So raise your voice, call your legislators, call your state and federal legislators, and let's collectively advocate on that. Thank you, Ian. Thank you to all of you. Forget names.
Thank you. Thank you, Sarah. That's a lot of information in a very short time. So I appreciate the voluminous amount and the thoughtful presentations, not only yours, but Aldwin, Regina, Nina. Thank you all. for providing us with some food for thought, and really not a end point, but a starting point, right? One of the participants, just as a matter of context, was inquiring about the data for referrals and for substantiations. One of the things that I think is a perfect segue into what one of the attendees talked about was this incredible need to bolster our childcare system. If we're going to have a return to somewhat of normalcy, how are we possibly going to do that when we are faced with the choice, the continued choice of the inability to think about safe, nurturing, and protective childcare versus keeping kids at home, which affect communities of color so much more significantly? And why are we not looking from the lowest end of the spectrum from the perspective of children's age up, rather than the top people who are getting support from businesses, for example, down, right? We've created this support system from a institutional basis that really does have to change. Anyway, I think this may be a good opportunity to talk about maybe a part 2 for this webinar. Once we start getting ideas to expand some of the programmatic and some of the logistical and some of the resource and some of the legal interventions that are going to expose themselves and be presented in the next month, if not further months, especially as schools start heading up as we look at healthcare reform. This will be an outstanding opportunity to do that. So once again, thank you to our panelists, Nina Livingston, Regina Dighton, Aldwin Allen, Sarah Egan, to my erstwhile co-host and colleagues, Stacy Cote. Thank you all for joining us today. And a note that the webinar was in fact recorded. It will be available on our website, cca-ct.org. We will have all of the resource information that we presented on the website as well. And per a request, we will try to send out those links and some of those documents directly via to the registrants on an email. We have a COVID-specific resource site, as Sarah talked about, as do obviously a number of other organizations. But if you go to our website and look for the red box COVID resources, we certainly would appreciate that. It also has some of our systemic agenda items that as we move forward at the center, looking forward to kind of change the specter of how we're going to view these interventions for children. So unless you have anything else, Stacy, I am again very thankful for all of you who joined us, and we look forward to continuing this discussion in the future. And again, thank you to our panelists, and stay safe, everyone. Keep doing the good work that you do, and we look forward to seeing you all. Hopefully, not socially distant, Sarah, but physically distant in the near future. Thanks again, everybody.
Take care.
Thank you.
Bye.
Bye-bye.